The SCOT-HEART trial was a trial of 4,000 patients with stable chest pain who had come to the cardiology clinic for investigation. What we found was if you added in a CT coronary angiogram, you halved the rate of myocardial infarction and coronary heart disease death at 5 years. So this was a substantial reduction in the events of these patients. So what we did is we recruited patients from a standard clinic, and these were all comers, very representative of the type of patients that come through the clinic, so both low, intermediate and high risk. And we took patients who were going for an invasive angiogram, who were going for further testing, and we randomized them all to either no CT or CT. But if they didn't get a CT, they were allowed access to any investigation that was permitted. What we found was that the CT coronary angiogram clarified the diagnosis and made the clinician more certain whether they had angina or not. And that changed treatment in 1 in 4 patients. So the tablets that they were given were changed in 1 in 4 patients. And we then followed them up slowly over a period of time, over 5 years, and that's when we saw the benefit being accrued. One of the interesting features of the trial, and one of the criticisms of CT angiography, is that it increases the rate of invasive angiography. So immediately after the CT angiogram, more patients get an invasive angiogram and more patients get bypass surgery or stenting. So people have been saying, well, this extra test, it just incurs more cost, doesn't affect outcome. What we've shown, it does affect outcome, and not only that, over the 5-year period, the number of people in the standard care arm who didn't get the CT coronary angiogram, they had more and more angiograms, so that by the end of the 5 years, there was the same rate. The same was also true with bypass surgery and stenting. Over the 5-year period, the standard care arm crept up so that at the end of the 5 years, they were just as likely to have had stenting and bypass surgery as the patients who'd had the CT coronary angiogram. So what does this tell us? What it tells us is if you do a CT coronary angiogram, you make the right diagnosis at the beginning, you give them the right treatment, and it stops them needing more treatment later, and it halves the rate of them having a heart attack.
The long-term follow-up of SCOT-HEART, which was presented here at the ESC and published simultaneously in the New England Journal, very important information. In randomized trials of diagnostic testing strategies, it's actually never really been shown that management informed by the test reduces or improves outcomes. So here there was a very clear reduction in non-fatal myocardial infarctions over long-term follow-up. It was hinted at, there was a little hint of it in their earlier short-term follow-up, but now it's very clear. So that's really important. It's never been shown before. And the other thing about SCOT-HEART was that the long-term follow-up was the first time that a CTA comparison trial didn't show an increase in catheterizations and revascularizations. In virtually every other trial, the PROMISE trial in stable patients, 3 different trials in emergency department patients, those randomized to have CT have always had higher rates of referral to catheterization and revascularization, probably because, physicians see stenoses and they feel like they have to do something a little bit more than you would with functional testing. So in SCOT-HEART was different in that over the long-term follow-up there was no difference in who went to cath or revascularization. So that was an important secondary finding. So probably the reduction in infarctions had to do with changes in medications.